My name is Dr. Patricia Wright, and I'm a part-time faculty member in the PhD in Palliative Care program. My role in the PhD program is to teach two courses. I teach the P-Core course, which is the Patient-Centered Outcomes and Research course. And in that course, we really look at what are outcomes that affect patients in research. So we're not really so much focused on research that doesn't mean anything. In this program, we want our research to make a difference in the lives of people. So our students are conducting research that focuses on individuals, families, communities, and of course, around the globe. The other course that I teach is a qualitative research course. So that's a course where students learn how to conduct research that is not quantitative, meaning it doesn't have numbers and statistics. Rather, they talk to individuals to gather data about their experiences. And so this is a good research method to use when you want to explore an experience that is different from your own experience and learn from the people who are living it. So they're the two courses that I teach. I also do advising along with Dr. Lynn McPherson and mentor the doctoral students through their doctoral projects as well. So the purpose of the program is to prepare the next generation of palliative care researchers. That's what makes this program different from a master's program or from a PhD program in any other field. So students who complete this program will be prepared to carry out their own independent research on any topic in palliative care. And palliative care is an interdisciplinary field that is focused on alleviating suffering in all of its forms. So students who become graduates of this program will be well positioned to conduct research into any symptom that people with chronic illnesses may have, or any of the emotional pieces that go with having a chronic illness, including spirituality, psychosocial issues, physical symptoms, and so on. So good candidates for this degree are people who have a nice background in palliative care. They can come from any specialty. So we have had nurses, nurse practitioners, social workers, chaplains, physicians, speech therapists, pharmacists. Any specialty is welcome into the program. We have had people who are not healthcare professionals come into the program because this is an area that they're really interested in. So the program is open to anyone who has a good background in palliative care and who wants to dedicate their career to research on palliative care. Graduates from this program will be well poised to carry out research on palliative care. And I mentioned some aspects of that before, but some of our doctoral students, some of their topics have been grief expressions in children, the lived experiences of having a serious illness, what it's like to live through having a terminal illness. What is that like when you find out that you have a terminal illness or that someone you love has a terminal illness? Looking at symptoms, how do we measure symptoms? How do we assess symptoms, and how do we treat symptoms? So these are all of the aspects of palliative care that our students have researched and then will take into the world and sort of make their own mark as an expert in this field and carry that forward, hopefully for the next generation after them as well. This program is the only one in the country. It's the only one that is online. We have students from all over the world come into this program. I would recommend it highly for anyone who is interested in a career in palliative care research. And yeah, just come and see us.